Hi, I'm Dr. Megan Mello. I'm a family and obesity medicine physician, and I'm here today to talk about common questions that I get asked from my patients. Specifically, today we're going to be talking about vitamins. As you may well know, during our busy primary care visits, whether you're in for a physical or for something else, there are many questions that we may or may not have time to address. And one of those common questions that I get asked frequently is about vitamins. And, how do we think about our nutrition when it relates to our vitamin intake? And so we're going to talk about that today. I'd like you to consider this as informational, as educational, but I'm not providing you medical advice, and it's important that you understand that watching this video does not constitute my own medical recommendations. It's important to talk to your own primary care provider about what is specifically right for you. I do hope that this helps to facilitate that conversation and give you some ideas about how you can be on track with your vitamins and have some clear answers. So let's get started. So common questions that I get asked are, should I take vitamins? What vitamins should I take? How much? Should I just take more? Isn't that better? What do vitamins do anyway? Many of us have this idea that vitamins make us more healthy. We don't actually know what they do. So we're going to talk a little bit about that and who needs vitamins. So what are vitamins? Vitamins are a collection of what's called micronutrients, so small amounts of chemicals that are important in our body for a wide variety of functions. Some of the vitamins that we take, like vitamin A, are important precursor compounds. That is, they are used by our body to make other substances. So vitamin A, for example, is important in making some of the photoreceptors, the light receptors, in the back of our eyes that are especially important for seeing at nighttime. Vitamin A has a host of other organs that it is important for, but that's kind of one of the main reasons. So it's a precursor. It is used to make something else. Other vitamins are what are called cofactors. That is, they are chemicals that help some other kind of process in the body. They might aid an enzyme with digestion. They might contribute to, better deposition of calcium in your bones, for example. So a lot of different important functions in our body. And who needs vitamins? We all need vitamins. The question is, do we all need a vitamin supplement? And I hope to be able to help answer that question for you. So who should take vitamins? It really depends. So I'm going to be focusing on adults for the purpose of the conversation today. And the questions that we ask about who might need a vitamin supplement, depends on your age. It depends on the quality of the foods that you eat, which I'll generally refer to as your diet. I'm not talking about a weight loss diet. I'm just talking about the collection of foods that you eat on a regular basis. It depends on your health factors. For example, are you pregnant? That's going to change your nutritional requirements. And then, oddly, there are some environmental factors as well that contribute to this question. What we know from the evidence is that eating a wide range of colorful fruits and vegetables, whole grains, good dietary sources of calcium, which includes cow's milk or almonds or almond milk or chia seeds or dark leafy green vegetables, provides most of the nutrients that most adults need for their overall health. People who choose to eat meat and animal products also get some nutrients such as B12, which are less commonly found in plant-based foods. So it depends on what you're eating as well as your health factors. And so I'm going to go through some specific examples of groups of people who may need a vitamin supplement, and then we'll talk about it in more detail. Those groups include people who are pregnant or breastfeeding, people who consume 10 or more servings of alcohol in a week, people who have a body mass index of 30 or more, including excess body fat, people with malabsorption disorders, such as Crohn's disease or celiac disease, and people who do not eat meat or animal products. we'll start off with people who are pregnant or breastfeeding. Because the pregnant body or the breastfeeding body is literally feeding another body, and a growing one at that, there are extra nutrients that are required in order to make sure that both the host body, right, the person who is feeding the extra body, and the extra body get enough nutrition that they need. Some specific nutrients that we often become deficient in during pregnancy and breastfeeding include iron and folic acid. And these both have important roles. Iron is necessary for, proper blood formation, and folic acid is really important, especially early on in pregnancy, because it helps to create the structure that becomes the spine and the spinal cord and to have them close properly. So when people are first aware that they are becoming pregnant, or they're choosing to become pregnant, or trying for a pregnancy, we will commonly recommend that those people take prenatal vitamins, which do by law include both iron and folic acid. Many prenatal vitamins exist in the world, and the market is huge for prenatal vitamins, often including extra nutrients such as lutein or omega-3 fatty acids, commonly called fish oils. These nutrients may be helpful, but the evidence is less clear for them. So when I'm talking to my patients about prenatal vitamins, I often recommend that they go with a high quality, low cost prenatal vitamin, and that if they want to take additional supplements such as lutein or fish oil, that they take those on the side. Because of course, when manufacturers put those in all combination all together, the cost tends to grow up tremendously without providing any increase in quality. All right. People who drink 10 or more servings of alcohol per week. Now, the recommendations are slightly different between female bodies and male bodies in terms of how we define excess alcohol use. So I've split the difference here, and I've said 10 or more per week, but the recommendations may vary, just so that you're aware. When we are consuming that much alcohol on a regular basis, it's not uncommon that we are having some absorption difficulties with some specific vitamins, including vitamin B1, vitamin B12, as well as magnesium. We may not have levels that are low enough to detect, or levels that are causing disease, but the longer we consume higher levels of alcohol, the more at risk we become for these nutritional deficiencies. And so it's really important that you share with your primary care provider and anyone else that's involved with your care what your actual alcohol intake is, and ask if you need any additional supplementation, such as a multivitamin or such as magnesium. For most adults, and we're going to talk a little bit more about this, a standard multivitamin is not considered unsafe. There are very few people who we would say shouldn't take a multivitamin, so that's a fairly easy recommendation to consider. However, magnesium can be more problematic, especially if you have kidney disease or certain other health conditions. So if that's you, if you are someone who's consuming a higher level of alcohol than is recommended, in addition to trying to decrease that level, I encourage you to talk to your primary care physician about, how do I take supplements? Am I able to take magnesium? Is there anything else that I should be considering as I work on reducing my alcohol? And of course, certainly it's important to realize that reducing alcohol, even if you don't meet the criteria for alcohol addiction, may still be something that you would benefit from help for. So it's important that you ask for help. People with a body mass index of 30 or more and excess body fat. And the reason I put it that way is that the body mass index scoring has significant problems in terms of how it is factoring into the proportion of body fat compared to a person's, height and build. I'm not going to go into the rabbit hole on that, but just to say, if you have a body mass index of 30 and you are a high-level bodybuilder with a lot of muscle mass, this is not necessarily relevant to you. But if you have a body mass index of 30 or more and you have excess body fat, then you may have some malabsorption of nutrients, which can be related to the way that your gut hormones are working, as well as the gut microbiome, which often looks different in people with higher body mass indexes and excess body fat. So people at a higher body weight who have excess body fat are generally recommended to take some nutritional supplements, including a multivitamin, sometimes an iron supplement, and sometimes vitamin D supplements. So if this is something that affects you, you may want to consider also speaking with your primary care physician or provider and talking about, would you benefit from taking multivitamins? And of course, if you have questions about ways to reduce body fat, that's also a great resource. People with malabsorption. Most people with malabsorption, will have been diagnosed with some kind of condition and will often receive nutritional recommendations about foods that they, should eat more of, foods that they should eat less of or avoid altogether, as well as nutritional supplementation with a multivitamin or other vitamin sources. And the reason is that if your body is not properly digesting fats or proteins, then it may also not be absorbing nutrients such as vitamins properly, and so you may need higher doses than other people. This comes up as well for people who've had, most kinds of intestinal surgery, including weight loss surgeries, that has, altered the normal anatomy of your body. And interestingly, the absorption of iron and vitamins and all these micronutrients happens in really different places all throughout the digestive system. And so when those places have been surgically altered, you may need additional vitamin doses, higher vitamin doses than other people in order to be able to properly, absorb the nutrients. If you haven't been diagnosed with some kind of malabsorption disorder, but you're concerned that you may have a problem, that's also a reason to go and visit your primary care provider. Frequent symptoms of malabsorption disorder might be chronic diarrhea, greasy, sort of fatty stools where you can see, sort of fat blobs floating in the toilet, or unexplained weight loss. Those would all be, unusual things that you would want to get checked out. People who don't eat meat, which is classically called vegetarianism, or animal products, which is called veganism, may be missing out on B12, which is a common nutrient that's found in its highest source from meat products, as well as some dairy products. And they may also be low on iron or calcium, which are other important micronutrients. So calcium and iron, have commonly been thought of things that are always deficient in, plant-based diets, but there are many, important sources of both calcium and iron that can come from plant-based diets. For calcium, you can look for almonds, you can look for chia seeds, dark leafy green vegetables, including spinach and broccoli. Those are all great sources. You may have to pay more attention if you're avoiding animal products compared to somebody who's eating dairy, but most people will be able to get great amounts of calcium from their diet with just a little bit of attention. Similarly, iron, we think of iron as being, often only in meat-containing products, but again, it's also found in many dark leafy green vegetables, such as spinach. It's found in beans. It's found oddly in raisins and some other common plant-based foods. And so calcium and iron may be, less important in terms of supplementation, so long as you're paying attention to getting rich sources of those foods in your diet. B12, like I said, is harder to get into a diet that does not include animal products. That does not mean that you ought to go out and eat animal products if you choose not to, or if there's some health reason why you shouldn't eat animal products. But you may benefit from taking a B12 supplement, and that would be a good thing also to discuss with your primary care provider. Typically, we would take a B12 supplement in a standard oral pill, although you'll find a lot of information about B12 injections as well as other forms, and you can discuss this, but most people will absorb B12 just fine by taking it by mouth in a pill. Vitamin D. Vitamin D is kind of an outlier vitamin because it's actually a hormone. And as you may have heard, people often will refer to it as the sunshine hormone because it's naturally produced by your body when your skin is exposed to sunlight. However, many of us live in climates which are temperate enough that we don't get sufficient strength and daily exposure of sunlight in order to make a good amount of vitamin D. Or if we are wearing sunscreen or other sun protective clothing when we're out in bright sunlight, as we should, to protect against skin cancers and sunburns, that also blocks the absorption of the sun rays that help to produce the vitamin D. And so you'll commonly see recommendations that most adults, especially living in the United States and northern climates, will benefit from taking a vitamin D supplement. When you go to the store, you'll often see that vitamin D supplements come in anywhere from 600 international units all the way up to 5,000 and 10,000. It's not been shown for most adults with relatively normal vitamin D absorption and without severe vitamin D deficiency, which is detected on blood tests. Most adults will benefit from taking 1,000 international units or the standard dose, which might be 600 or 800 international units that you might find in a multivitamin. Most adults will do just fine on that dose. It is important to take vitamin D with a meal containing fat because it is a fat-soluble vitamin and you will not absorb it if you take it on an empty stomach. If you have concerns about vitamin D deficiency for any reason, that is a blood level that can be checked, although generally recommendations are that we shouldn't go and chase around blood levels. For most people, we should simply take a vitamin D supplement. So then the question becomes, well, should I just do it anyway? Aren't they just healthy for you? Again, it really kind of depends on what we think vitamins are doing for us. If you are someone who is looking for, kind of their best shot at overall health in general, then what we can see is that actually eating a high quality diet that contains lots of colorful fruits and vegetables, whole grains, meat and animal products, if you choose to consume them, beans, nuts, seeds, healthy oils. If you eat a wide variety of those foods, then more likely than not, you're going to get adequate nutrition from those foods. If you eat a more standard American diet, which the acronym for is SAD, Standard American Diet, which contains a lot of added sugars, it contains a lot of highly processed foods like chips and crackers and fried foods, muffins, baked goods, things like that. If you do not eat very many whole grains, if you do not eat very many fruits and vegetables, then you are probably missing a wide variety of adequate intake of vitamins and nutrients. And so you may benefit from a multivitamin. But when we look overall at who has better health, it definitely comes down to diet. So you cannot supplement your way out of a bad diet. That is, adding a multivitamin to a diet that contains a lot of highly processed foods, is very high in added sugars and added fats and sodium. Adding a multivitamin doesn't really improve our overall health if that is your goal. Spoiler alert. So that being said, multivitamins are generally considered to be safe for most adults. There are small numbers of people who shouldn't take them or should only take them under the advisement of their physicians. That does include smokers, especially male smokers who are over the age of 50. In particular, the nutrient beta-carotene consumed on a regular basis may actually increase the risk for lung cancer, which of course is something that we don't want. There's very few other people who a multivitamin would be unsafe for, but again, it's worth discussing with your physician or primary care provider and discuss, what are your health goals with it. We do see in studies that multivitamins do not help to reduce our risk for important health conditions such as cardiovascular disease, diabetes, strokes, or cancers. So we do know that generally eating, a more plant-based diet that's rich in fruits and vegetables and whole grains does really help to prevent and minimize the risk of those conditions. But can we supplement our way out of it? No, we can't do it. Okay. So I hope that this has provided you with some helpful information about who might benefit from taking vitamin supplements and who maybe doesn't need them. And if your overall goal is to improve your health, then I would strongly suggest that you start paying attention to the quality of the foods that you eat and try to include more fruits, vegetables, and whole grains. Rather than start to think about, dropping all the foods that you enjoy eating, think about incorporating more healthy foods into the way that you're eating now. And then you can slowly start to step back from unhealthier patterns of eating if that's a problem for you. I hope you have a great rest of your day. Thank you so much for watching. Bye-bye.